Hospital settings can feel kind of sterilized, and what we want to do is recreate a home environment, because that's exactly where we're hoping these kids are going to go afterwards. They're already away from home, away from their friends and family or their caregivers, and we really want to provide a sense of comfort and safety for them. So they are going to become their most vulnerable and deal with a lot of issues that maybe they've been suppressing or dealing with themselves.
We want it to be a warm place. We want it to be somewhere that does feel like a second home. When it comes to life here in our care, it gives an environment for the kids to really practice in a place that does feel like home, for those skills to then go and apply back at home.
Anxiety really comes from the unknowing. And so when we are consistent every single day with the same type of structure, so waking up on time, if there's school, if there's an activity, they know that ahead of time, they know how to prepare for it. One of the biggest things that we hear from our students is might be sleeping a lot, and they're never going to school, and their days are so inconsistent, and they really don't know what to do with themselves, that we want to help kind of develop that internal motivation. And you do that by providing them a structure at first. And then we really ask them to collaborate in what their structure then looks like, because when they go home, they're not going to have an adult standing right next to them every single day. They have to have that internal motivation to get up. Okay, now I need to brush my teeth. Now I need to make sure I'm eating something. Now I know I'm going to school. It really does help alleviate symptoms. It does provide a sense of security and safety. And I think that's more than just for our teens. I think that's for anybody.
And we see a variety of mental health conditions. The most common, I would say, is depression and anxiety. We'll see plenty of self-harm that comes with that. ADHD, we see PTSD, OCD, ODD, reactive attachment disorder, a variety of things.
Stress tolerance is almost non-existent for our kids, right? They're so used to that instant gratification because of technology, because they have everything right around them, that they have almost no distress tolerance. So if you wanted to break it down to like a diagnosis, we see a lot of depression, we see a lot of anxiety, we see a lot of truancy. Truancy is just students not going to school, and that can be because of depression, anxiety, trauma, any of those reasons. There's a lot of issues with family dynamics. Our caregivers are kind of feeling at a loss, because this is like a common thing that has been said to me from our caregivers, is we just didn't deal with this stuff as a kid, right? And like, how true is that statement? Right. Well, you also weren't living during a pandemic. And when adults went through the pandemic, we all have already hit those major milestones of knowing how to socialize with people in person, that having our children try and go through that, they miss some really major learning opportunities of how to interact with other people, and what's appropriate social interactions and what's not appropriate. So there's a lot of things about just learning how to have healthy relationships and connections with other people because of it.
Different genders have people molded to handle things in unique ways, and a lot of it does overlap. When I look at our young ladies, we most often see attachment-based behaviors where we're self-harming, maybe we have lower self-esteem, we may have struggles with relating with our peers in a healthy way, but we will also see a tendency for more storytelling or more narrative expansion, I guess you could say, where we're trying to get a need met in a creative way. And so, some people may say, oh, that child is being manipulative. Well, we look at it a different way. We look at it through the lens of, this child is using creative coping skills that they have tailored back at home to serve them in some way. And our role here, especially with our young ladies, is to help them meet their needs in a way that is healthy and life-giving, versus meeting needs in a way that takes away from our experience or from our productivity towards our goals. But I would say that is maybe the most common difference between our males and our females, is some of that lived in experience that helps them cope, versus staying true to ourselves and focusing on the things that maybe are a little bit of a layer deeper and are harder to talk about.
Outpatient does a fantastic job with the resources that they have. Once that student and that family leave their clinic, it's really hard to know the level of safety that everybody has when they go back to whatever home environment they have. If there's a lot of activation or increase in behaviors, whether it's yelling and screaming and cursing and verbal threats, maybe suicidal ideation, and there's also that physical component. Are they self-harming? Are they running away? Are they isolating in their room? Right? Like, there's so many different ways that like dysregulation can show up in an individual, that if the caregivers feel like this is out of control and they've been doing everything they possibly could to keep themselves and their family safe, and the student is still getting activated to a level that we feel like we need an outside person to now help us, I would say residential is where we can provide that 24/7 care.
They come here and what they're doing is practicing and practicing and getting a push from every angle, from their teacher in academics to the person that puts the lights out at night and is like, good night everybody, to the person who's helping with the chores in the morning, or who maybe is serving breakfast. Even our kitchen staff is coming from every angle in their day, which really gives it that healthy jump start. And I think the big change there that you would be wanting to see is like, how do we have success in multiple areas of this child's life versus just what they are talking about in therapy. We want to bring it full circle so that they're thriving and less so in that survival mode, using the skills that don't serve them anymore. We heavily use DBT, dialectical behavioral therapy, within our programs. And what that looks like in the day to day is we're teaching skills, we're teaching coping skills to a client, as well as we're inviting them to teach their peers. And so when we're sitting in the middle of an art activity and the client hears something from their peer that maybe is upsetting or causes them some level of distress, that is where we're jumping in as a team. And eventually your child is jumping in to their peers and saying, hey, this would be a good time to try this coping skill, or let's use 5, 4, 3, 2, 1, which is breathing and senses. And so there's this like whole conversation that's going on throughout the day with the clients around these skills and using and practicing them, because we don't know what they are when we come in most often, and we don't know that they work, or we don't trust that they work. And so sometimes it's just hand in hand trying those skills out. And so you'll see a life coach that's one of our mentors, sitting with a client outside of the art room, and they're going through different pieces of their day and what's happened, what's led to this moment, how are we feeling, and what could possibly work to help us get us through this moment. We don't want to avoid the moment, but we want to get through it, and we want to use our resources to get through it so that we build confidence in ourselves to handle a peer at school saying something that hurts our feelings, and how do we cope with that versus turning on ourselves and coping in a way that's unhealthy. So it's a big conversation here, and it's also it's the picture of action, truly. So even in treatment team, we're looking at those DBT skills that the client is using most frequently or is most familiar with, and we're honing in on how we can help them apply those in new circumstances, as well as have them expand on those skills. So, you hear a lot of times a client will say, well, my MP3 and music is what helps me cope. And we say, that's awesome. Let's use that and let's cope with the moment that you're in, and then let's get to a thriving point. But also, what happens if you don't have your MP3 player? What do you do when you're in the middle of math class and you want to listen to your music and your teacher's like, not right now? We have to have variety, and we have to be well balanced and have plenty of resource to pull from whatever life throws us.
We look at what your life is. We talk about it with you. It's an active collaboration for you and your family. And it's, okay, how can DBT show up for you in your life that makes sense and that's applicable? Not every student is comfortable in talk therapy. Maybe they don't understand just yet how to identify their emotions and feelings in words that like we're asking them to do, but they can do it in a painting. They can do it in sculpture. We have animal assisted therapy. So we have a therapy dog here. Maybe the animal is easier. It's easier to talk to my therapy dog than it is to talk to another human being, because we know the dog's not going to judge us. We know the dog is going to love us unconditionally. We know that about dogs. And if you love dogs, you already have this type of connection and intimacy with the dog that you just can't get from an adult or from another human being, because there's a sense of safety to it. It's also providing an opportunity for practical application. If we're on a hike and someone feels really anxious and starting to feel a little overwhelmed, and we're in this experiential activity, you can engage in that DBT skill while you're in that hiking. Well, now you're just walking. So the next time that you're just walking, maybe it's to class, to your job, to the parking lot, or into a therapy session, you've already associated, but I can do this skill when I'm walking because I'm having you practice it in real time.
It's therapy in motion. It builds self-confidence, and it also builds identity. You go and you do this activity maybe around animals. So we have a therapeutic farm here on our campus, and we go down and we say, watch the animals and go stand next to an animal, and see, how it interacts with you and how you feel when you're interacting with it. Now switch animals. And, you're starting to recognize these different pieces that you wouldn't have even thought about beforehand. And then we take all of that content that they use or that they come up with in their outings or in their experiential activities, and we apply it across the week or across their stay. Hey, remember that time that you showed up in that experiential that we did where you led the whole crew through a challenge course blindfolded? Do you remember that? Like, that was amazing. And you were such a positive leader in that moment. Over here, how do we apply that where things aren't as safe, where people may not want to follow? What do you do then? And it takes it that next level from just what we're struggling with to how we expand who we are, how we show up, and how we interact with others in the world around us. It's one of my favorite parts of what we do here with the kids, because you can just see their eyes light up and see new parts of themselves be discovered. It's very heartwarming to be a part of, and it's also a place where really real emotions can come out and then be expanded on and used positively moving forward. I look at family therapy as the work in tandem in many ways, because they are doing activities and therapy assignments and challenging questions for the family just as much to grow, so that when the child comes back from treatment here with us at Embark, they aren't coming back to the exact same environment. They're coming back to a whole system of change.
A lot of our caregivers are so focused on the student because that's what they're used to, keeping them alive, keeping them safe, that they forget about themselves. And I really need people to understand, like, it's okay to think about yourself too and what you need to heal, because you're going to start recognizing, I have triggers. I need self-care. I have to go and talk to somebody. I didn't like how my student just said that to me. How can I communicate with them so they understand my feelings better? Because I think sometimes our caregivers think that they're not allowed to have feelings because it'll set off the student. It's like, no, everybody has feelings. Everybody has a mental health. You're all in this together.
The families too, I think they're going through many of the exact same assignments that the clients are going through. So there's personal growth, not just for their child, but for them as well. And even for siblings, we've pulled siblings in to these conversations and to this work to really have an environment that the client is returning back to, has forward movement.
There's family sessions that's where you learn how to communicate and active listen and talk about the things that may have happened in the past, or how do you use those past things as learning opportunities so we don't repeat them in the future. There's parent coaching. So a lot of our parents and caregivers will go, well, what if they say this to me? What do I say back? So we want to give that opportune time of like teaching moments for the caregivers to ask us those questions that maybe they didn't have an opportunity to ask somebody before.
If you don't have family therapy going on, it's like working in one direction when you could be working in every direction and the growth that could come from it. It's a number one skill that a child has when they return home from an Embark program is communication skills. They know how, in a healthy way, how to ask for what they need and also how to hear what other people need and respond to that. And without that communication, it makes it much more challenging for the client to go through a struggle when they leave and say, hey, I'm struggling.
Is the person safe? How are they safe? What does safety even look like? We like to talk about it at Embark as emotionally, mentally, physically. Like, can you communicate your needs to somebody where they can meet those needs to keep you safe too? Utilizing your coping skills that are safe coping skills, not the maladaptive ones. Maladaptive are the dangerous, unhealthy things. Do you know where to go? If it hits a crisis, do you have a crisis plan? Do you feel confident in executing that crisis plan? The crisis plan could be going to the ER or calling crisis or talking to your outpatient therapist or knowing that the crisis is really only a level 1 out of a scale of 1 to 10 and that you guys can do this. What we do is provide tools to families and students so they know how to continue their journey in decreasing all these things, because that is what healing is. Healing is not this one space over here. We talk about joy, and joy is the journey of healing, because healing is baby steps to things that are safer and healthier for you and your family. Time, consistency, stability, communication are all things that build towards trust. And when I say time, I mean over time, with enough consistent behavior of being safe, there's going to be that trust again of, oh, my kid can really go and do this by themselves because they have shown me they've been able to do it for the last couple of months. Or the student saying, I know my caregiver can handle me coming to them with a problem and they're not going to try and fix it. Because they've shown that they ask me questions to understand it more instead of just trying to fix it immediately. It's not the who that we're upset with in effective communication. It is the what that we're both searching for to help everyone feel safe again.
Everything is a learning opportunity. And I would say I do see clients leave here with that mindset of everything is a learning opportunity. It's okay when things don't go perfectly. I can try again. And we can communicate through that process. Mom, I'm sorry I didn't come in at curfew. Here's why I didn't, and here's what I was frustrated about, and here's what I could have done. And then mom has also practiced those skills, and mom can be able to receive that mistake in a way that they can both grow from and get closer together in relationship as a result.
When the client comes to us, we will reach out to school districts and try and coordinate with them whatever the academic journey looked like from where that student came from. And then we'll be honest and say, okay, so this is what we're capable of over here. What do you need to make sure that no credits are being lost? Because we want to make sure that them being in school with us isn't going to go at their academic detriment. Like we do credit recovery. We've had kids graduate with us from high school, right? Like we don't want this to be more of an obstacle than it already feels. So we have academic coordinators that will reach out to school districts and work with the families on making sure that like whatever school has to look like in an RTC, it's going to be modified, but it's going to try and keep them on track with where they've been. Something that's a really big benefit to this is we have a lot of professionals that are observing and intervening with the student. So we've helped with putting in input for IEPs. So that's the individualized education plan. We've helped write 504s, which is more like concentration on like behavior, mental health in the school and not education directly. We've provided a lot of feedback to the school about the best interventions or classroom environment. We've met with teachers. We've worked with school districts on like maybe therapeutic schools would be a better transition than integrating them right back in. Like the whole purpose is for us to break the cycle for everybody.
We talk about distress tolerance building a lot here at our programs. And so everything that is happening back at home before coming to an Embark program, it's distress, and it's distress intolerance. If you were to flip it backwards, it's distress intolerance that these kiddos are going through. And so every moment in our day is that mirror. We call it we're in a snow globe. If you shake the snow globe up a little bit, things happen inside that snow globe. And so that's what's happening here on our campuses, where they're going through day to day. It becomes their reality. It becomes all that they know, and very much right here in front of them, that this is their life. And so they'll start to respond like it is their life. And even if their peer is maybe not being the nicest or is doing things that they wish they wouldn't do, they don't have that foresight to be able to see like, okay, well, they're struggling too. I'm struggling as well. They're like, that peer, like, I need to do something right now. And they'll get upset. Right. And that's because it's right here in front of them. And so in those moments, our life coaches, our clinical teams, our admin staff are very much trained to recognize those moments of distress coming up. And we pop in to their world even more so. We're like, hey, this is one of those moments where you're like, I notice your hands are shaking, or you're starting to get, your pace is starting to speed, and the way that you're speaking is starting to get louder. Like, these are all things that tell me you may be upset right now. And we help them to recognize that they're upset, because for a long time, in the beginning, there's a time where we see our clients not even have that self-awareness yet of, I'm getting upset and I could choose something different. But the more I get upset, the more that lid flips in our brains, and we lose that thinking that can help us maintain our relationships, maintain our status in school, or in the future, our jobs. And so we're helping them, one, recognize it. Two, now we recognize it. What can we do about that distress, and how can we manage it ourselves? How do we control ourselves versus depending on those around us to manage themselves so that we can manage ourselves? And then we're looking at how do we apply those skills? And then what's our recall on all of those things moving forward? So it's not a perfect line of increase for our clients where they recognize that they're upset, and they're like, I recognize I'm upset. Now I need to use a coping skill. It comes in waves and it goes up and down. And we look for repetition. We look for opportunity. And so we don't mind when those upset moments come, because we're there for the kids, first of all. But second, it's another opportunity to practice so that when they do go back home, they know how to recognize their distress when it's coming and how it's going to affect them. But also, what are all my options right now and my skills that I could apply to make sure that the things that are important to me can stay important to me and can stay present in my life, like my relationships, my schooling, maybe my job that I have, my siblings and my relationship there, or my privileges back at home, my cell phone. Maybe that's a driving force. But most often they're coming away with a lot of practice.
I am so grateful to the families that reach back out to us and let us know how they're doing, how their child is doing. It's hard not to build relationships, like genuine relationships with those who you work with. I've had a student and their caregiver reach out to me. They're applying for colleges, and they applied for 5 and they got into their first one this week. They're still waiting for the other 4. They have a lot of close relationships now, when it was more like isolation and they didn't. They're in extracurricular activities when that was never a thing. I've got another one that was an athlete, and she is all state in her college right now, and she's in her second year, and she didn't think that she was going to make it to 18.
We had this one young lady. She was very much like, I would say, deer in the headlights, came here and not necessarily resistant, but just not sure what to make of the program and what she would really be gaining. She had very low hope in her life and had quite a few suicide attempts before coming our way. She would look for things to self-harm with anywhere she could find them. And it was a really tough pattern for her to break from. Like, we got through the suicide ideation and the planning, but then we still had self-harm carrying through. And it was amazing to watch this young lady in the last, I would say, few weeks of her stay start to help others who were coming into the program or who were struggling with self-harm or suicide ideation support, and became like a peer coach for those clients. And that client actually has come back to visit our program multiple times just to say hello. It's heartwarming to see the work that child is doing and that family is doing produce a whole new opportunity for them as a family.
I have another one who just graduated high school. The goal was to help her feel better about herself, find motivation to live. And she graduated high school. She made it to 18. She's licensed cosmetologist. And they invited me to a celebration of life dinner, which when one hears celebration of life, it's usually we're honoring a person that passed. And here we were actually honoring a person who wasn't sure they were going to live, and it was everybody who really helped her on her journey to be better and okay. I've got kids that want to be therapists. They're going back to be therapists, and they want to come and work at Embark. They want to give back to the community. So I think that's really touching. I think that's amazing. I think I want our caregivers to know that we recognize how difficult it is to make this decision of, does my child need residential care or not? That's such a heavy, heavy question for somebody to ask, especially when you probably never thought you would ever have to ask that question, right? Nobody wakes up one day and dreams a life of, do I want to have an absolutely perfect life, or do I want life to be so chaotic and unknowing and dangerous that I need residential care? Nobody picks the second one, right? And we get that. We understand it. And there's no judgment here. And we respect the decision that you're going to make. And I think when people are looking for what's the best treatment for our student, whether it's with Whitehaven or Marion or Independence, San Martin, we've got a ton of amazing facilities in Embark. Make sure the place that you're choosing, the professionals are genuine and authentic in their care for you and your family. And that's the biggest thing that you can take away, right? It's not about the modalities. It's about the relationships and the connections that you're going to make with these people. I think I want our caregivers to know that we see you. We applaud you for your resilience and everything that you've done, and that we're here for you. Genuinely, we are here for you.